for joining this session of the lecture series on implementation research. And this session is about mixed method. Let me take the opportunity for those of you who don't know Professor Sarkar to briefly introduce Professor Sarkar, our guest speaker. Professor Sarkar is an implementation researcher and a mixed method expert. She's a physician with a master in public health from Harvard University and a doctorate in public health from University of Heidelberg in Germany. During her career, she has taught across 4 continents and has extensive research experience in Africa and Bangladesh. Right now, Professor Sarkar is a professor of practice in Brown University. And prior to that, she was the associate dean and professor at BRAC James Grant School of Public Health in Bangladesh. She also served as the acting dean in 2015, and she's the founder of the Center of Excellence of Science of Implementation and Scale-Up in Bangladesh. So Professor Sarkar has extensive experience, and she is a member of very many societies and committees, including the chair of advisory board of HRP Alliance and also evaluation advisory committee for Gavi. So without further ado, I welcome Professor Sarkar, and we shall start the lectures. And yes, so the whole lecture will be for less than 1 hour, colleagues. If you have any questions, you write it in the chat or you can raise hands. Over to you, Professor Sarkar.
Thank you very much, Dr. Mahanas, for your like a kind introduction. But I'm happy to see, I was scrolling through the name. I think already few participants here are my students. They were my students at MPH. If I'm not wrong, like, you know, I see Navid, I see Oni. So there are few that you already know me, but thank you very much. It's a pleasure. Like, you know, this is kind of in the one topic which bridges 2 of my, I would say that I love teaching, that the mixed method and implementation research. So bringing them together, it's a really joyful kind of an experience for me. And please, like, you know, throughout the lecture, I will stop after one theme, and please raise your hand or like write on the chat box. And even if you think that when I'm talking, you feel that some things you didn't understand, please, please, please ask question. There is nothing called a stupid question or silly question. Any question is important. So please, 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 because sometimes I get very passionate and I keep talking. So you have to stop me and say that, oh, Professor Malavika or Malavika, please explain this. Okay. So thank you so much. So this is a mixed method in implementation research, that so the whole lecture will be the concept of the mixed method and how and the mixed method you can use in the implementation research. We'll give an example, the case study, so that you kind of have a practical example. So there are different themes. And as I mentioned that, please ask me question whenever you feel like asking. Okay. So the implementation research, you already like kind of know, because I do think that like you had a series of lectures on implementation research, but the implementation research by this time you already know that it's not a very straightforward epidemiological survey or qualitative exploration, because health system is complex. The stakeholders of those health systems, that whether it's the patients, beneficiaries, their family members, the doctors, nurses, frontline healthcare worker. So this is also, we are complex human being, and it's like dealing with the real life. So it's very important that implementation research requires both method most cases, because some of the questions cannot be answered only applying the quantitative research method or the qualitative research method. So mixed method, as I say, that combination of quantitative and qualitative. But we also have to remember that it has to be the mixing method, and any method, whenever we do research, is guided by the research question. So the research question is the like a backbone of a research. So research question, if a research question requires a quantitative, then you do the quantitative research. If to answer research question requires qualitative, you do the qualitative. If it requires both, we do both quantitative and qualitative. Okay. So the implementation research that today what we'll discuss about that the quantitative and qualitative, because before mixing the method is very important for your conceptual clarity. And it might be a little bit repetition for many of you, maybe all of you, because all of you have done already the master's or some of your postdoc, the fellow, the faculty teaching. So bear with me. I'll not go to the details of the quantitative qualitative, but just for conceptual clarity, there's a difference between the mixed method and multi-method, which is a very, very common practice. Most cases, we do quantitative and qualitative, and we present it as a mixed method, which is not a mixed method. And then why there's an added value of using mixed method, and different types of mixed method we will discuss with an example. Okay. So implementation research not necessarily always requires mixed method. Some of the implemented research can be enough with the quantitative. So for example, if you want to look at the coverage, which is one of the implementation outcome, it can only be done quantitative, that coverage of that service. Sometimes you want to understand what are the barriers or facilitators of the health worker when they're implementing the certain intervention, and you need to explore and understand the qualitative. You don't need mixed method. But then whenever there's a question that you think that it cannot be answered only using one method or applying method, because that research question requires mixed method to answer that question, then you apply mixed method. So remember that, again, going back to the research question is the backbone. Research question will guide you. And if you feel like this is a mixed method that you think that from your experience on the way you understand that you require both data, then you have to reformulate your research question. Not have have a research question that, understanding of the beneficiaries' experience, like in those who are attending the tuberculosis program, and then think, I'll do a survey. No, because your research question is understanding, and which you cannot answer through the survey. You need qualitative. Okay, so you need to remember that research question needs to be reformulated. So if we look at the implementation research, why do we do implementation research? Okay, so definitely the very simple and mostly what we do, even I have done series of those, that identifying and understanding implementation barriers and facilitators, that when you implement, because the implementation is the key. The world suffers from pilotitis. There are a lot of pilot intervention and which worked very well, but then when you scale it up or when you integrate it in the routine healthcare system, it doesn't work. And mostly because of the implementation. So you try to understand the facilitating barriers. There are studies that's looking at the implementation outcome. So implementation outcome, remember, implementation outcome is not health outcome. Implementation outcome. So the health outcome is that you look at the mortality, morbidity, you look at the disease cure rate, but implementation outcome that you look at the fidelity. This means paper versus actual implementation of your program. You look at the feasibility of the intervention. You look at the coverage. You look at the costing. You look at the adoption of the program. You look at the acceptability. So remember, implementation outcome is not health outcome. I think you already know that. Finally, we also use implementation research when you want to test the implementation strategy, because it's the delivery mechanism. You can think about that. If you the COVID vaccination, if you want to offer the COVID vaccination in Nepal, in the mountain, the way you will deliver the COVID vaccination, maybe you will need more outreach because it's the mountain or hard to reach area. Or when you are in the urban slum, then your delivery mechanism will be health facility based. So the testing of different implementation strategy, while intervention is same, but implementation strategy is different, you need to test it. So just simple that what is the quantitative and qualitative? So the intent of the qualitative is explore and understand. Okay, and the question that we use, the word, the vocabulary, why and how. Whereas the quantitative is very much like, the describe, explain, and the test, like, how much, how many, the difference. Where the data collection, the qualitative is open-ended, because the qualitative, the instrument of the qualitative is the researcher themselves, because the quantitative is very close-ended and structured. So quantitative is linear, because what do you in quantitative? That you have a questionnaire, already you know the response, you ask them to kind of validate your hypothesis. So it's very linear. Your respondent has no kind of a scope to understand or explore, okay? Whereas qualitative is circular, it's iterative. Maybe you ask somebody question, think about that. You have asked about the gender-based violence. In the beginning, you ask the question and you respondent were like nervous or not answering. You stop there and you ask other question and you come back. So it's the iterative, the circular. So they are that's why they say that, like, researcher is the instrument, because only you know, and you respond to the next question depends on the response of the person. So if I say, why are not you using contraceptive method? And the women say that, I don't know what is contraceptive. Then your subsequent question will be based on that. If somebody answers that, because my husband doesn't want me to use that. So depending on the response, your subsequent question will be different. The sample size quantitative is large because the quantitative is all about breadth. Qualitative is small because it's all about depth. So in the quantitative, we need the generalization, representativeness, and in the qualitative, we need the depth. The forms of data, we know that the number and words. Analysis quantitative is always the reduction. This huge data set, and then you reduced it to maybe odds ratio, one number, or risk ratio, or prevalence. The statistics summarize, and in the qualitative is the content analysis. You do the inductive or deductive analysis. Researcher's role, quantitative it's epistemologically is positive based. So what is that? The researcher detach themselves from the respondent, because you have the question answer and you just tick, tick, tick. So you don't associate or don't get involved with the your respondent. But because in the qualitative, it's more about the personal and exploring, there is the researcher and the respondent, sometimes it's blurred, their relationship. And a generalization, that quantitative will generalize the findings. That's why we need the representativeness and the large sample. And in the qualitative, we say that not generalization, but the word we use, the vocabulary, transferability. So whatever you understood or know in a context, you transfer that to another context. So you can't generalize, okay? Okay, these are I don't want to go through and spend too much time, but you know that quantitative as the observation and experimental, qualitative is series of like a method, that very new methods now, deliberative interview, they do the visual diary, photo voice, the data quantitative, we do both primary and the secondary, and qualitative is ethnography, phenomenology, ground theory, the case studies, okay? But I think you already know that. So before I come to the mixed method, do you have any question about quantitative and qualitative, the difference? Okay, if not, okay, so now the mixed method. So mixed method, look at the name, that mixing method. Okay, so here we collect both quantitative and qualitative because to both method, we triangulate the information. The triangulation means looking at something from different perspective. Think of the triangle. You are looking from both two perspective. So we use the method quantitative, what triangulation I will discuss a little bit later, because it's a little bit confusing, because the same triangulation, we use it at a different level. But here, the two methods, okay? And then we apply a very selective quantitative and the qualitative component, but they need to be linked. And it's like, you can examine any aspect of implementation, whether you want to test it, or you want to look at the factors influence the implementation, or the challenges or enabling factors. So what is the benefit? Definitely benefit that sometimes you can't answer that question only using one method. I'll give you the answer, couple of examples. Because you know that only quantitative will not give me the comprehensive understanding of the problem. So one example that you are interested in looking at what factors influence the young girls not accessing healthcare, the tuberculosis treatment program. So the young girl, you want to understand the factors. And you think that based on the literature review and the, from your experience, okay, there are a lot of factors. And okay, there are maybe distance, maybe the knowledge, the finance, but also there could be stigma. And you felt that I cannot capture stigma using a survey because stigma is so community driven and personal, and there are like a gender aspect, there are socioeconomic, there are social norms and values. I need to understand the stigma using the qualitative method. So for other factors, you do a survey, and the factors you think that about the stigma or the perception of the community about the girl, going for TB care, you do the qualitative. So you want to answer one question, but you realize it's not possible for me to rely on only one method. So it gives the benefit from the multiple perspective, okay? And this is very complementary because you know that quantitative is about the breadth, not about the depth, but the qualitative explain. So sometimes you do the quantitative, you did a survey, maybe the COVID vaccination, the vaccine hesitancy, and you found that there are 25% people, they don't believe in COVID. They don't want to take the vaccine. And then you go and do the qualitative to explain that. Sometimes you think that, I will do a topic which is not very familiar. So, for example, one of my colleagues has done a study on infertility prevalence and found that the response was very poor about the infertility. And then she decided, okay, they use the very formal word for infertility, the local language, that Bangla word. And then she did a qualitative, and they found that there are 19 words they use to express the infertility. And from that qualitative data, extract the data, and then use that in the survey. So you see that how they complement each other, quantitative and qualitative. And it goes definitely the triangulation of the result that's supporting each other. So the mixed method and the multi-method. So I will give you a very simple example. So think about, I told you the student, the participants, this class, this is an in-person course, and I will offer you fruit yogurt. And so what I did, first I gave all of you one apple, and then after a few minutes, I gave you a yogurt, small kind of the yogurt. And then, is it fruit yogurt? Or what I did, I mixed the fruit proportionately with the yogurt, mixed it. It's not like an 20 kg of apple and one box of small amount of the yogurt. It has to be the proportionate, so the taste will be good, and not all fruits you can mix up. So that's the fruit yogurt. So the mixed method and multi-method is the similar thing, that in the mixed method, you integrate it, quantitative, qualitative, and you already know that your research question requires the mixed method. You cannot answer that question if you don't depend on both methods. Multi-method, that you did a quantitative survey, and then you felt that, oh, I need to do something to do focus group discussion. And you went and did the focus group discussion. So the method you select is a kind of more spontaneous, or maybe the completely two different topics, they are not linked. So most cases that people use a survey and few FGD, and they say that is the mixed method. That's a multi-method. That's also good, because you don't need always the mixed method. But the mixed method is from the very beginning, the research question when you formulate, you exactly know, I can't answer that using only quantitative and qualitative. I need both. So you plan, you select a type of mixed method which will be applicable to answer to that research question. Okay? Any question? You can write it on the chat box or even raise your hand. Okay. So I hope that you understood whatever I'm talking about.
I have a question.
Yes, please. Yes, please.
Okay.
Ilham. Yeah.
Yes, thank you so much, dear Dr. Sarkar. Just with regard to multi-method research and mixed method research, I would like to ask you, you already gave us a general example with regard to yogurt and fruity yogurt. Is it possible, please, because this is still a question for me for the clarification, do you have another example which came from something more specific to this field of research, to give us with an example, please?
Of the mixed method? Mixed method example, multi-method?
For the
method
precision and a little bit more clarification, the difference between these two, if you have another example, please, I would be grateful. Thank you.
Okay. So remember tuberculosis, I gave you the example that you want to know the factors which influence that, why young adolescent girls don't access the healthcare. And you saw that there are quantitative aspect, but also stigma. So you do qualitative and quantitative. So that's a mixed method. So for the same thing, I would give you the multi-method, so that we have done a study on the pediatric TB, and we were interested to see the pediatric TB prevalence, that how many children went for like a testing, the cough test. So after we did the survey, we asked them that the cough symptom, and where do they get the information. And we found that most of the respondents said that they received the information from the neighbor, but they have not mentioned the community health worker. And we were surprised, because the community health workers in Bangladesh, they really work the TB program. They give the direct observation therapy. And from that, we decided, oh, let's do some qualitative, that the FGD with the parents, what the community health worker kind of tell them when they come for the household visit. At the same time, we also wanted to do some in-depth interview with the community health worker to explore their understanding of the pediatric TB. So we did not decide that before. So there is a prevalence of the pediatric TB, that's quantitative survey. And then from that survey, we thought that, okay, let's do some. And then we did the in-depth interview with the community health worker. We found that many believe that the children don't have TB, or many believe that because they have the BCG, they can't have TB. So you see, that's a multi-method, because we have not kind of formulated our question in the beginning that, okay, like what can happen, or even separately you can do. We did it in other study, that maternal health. We wanted to, there are two separate research questions. So one question was that like an healthcare access factors for the pregnancy-related complication. But then second research question was that, like, the cause of maternal death, the verbal autopsy, because the women who die at home, not at the health facility. So there are two different separate questions. And the first question, we did a survey at the health facility, the women who come for antenatal care, that whether they will go for delivery. But then separately, we did the interview with the family members, those who died. So when you have a two distinct research questions, it may be the one topic, general topic, but they are not linked. They are not integrated. I'll give you the more mixed method kind of an example later on. But Ilham, is it clear now?
Right. Thank you so much, dear Dr.
Okay.
Sarkar. Many
Okay.
thanks. Thank you.
You're welcome. So the type of mixed method, don't look at the slides because it will confuse you. So tell me, I'm giving you the different example, okay? So the first example I gave you the tuberculosis. Remember the tuberculosis, you want to know all the factors. So one research question, and you want to know what are the factors. You looked at the factors and you thought, okay, if I do the survey, I know that all these factors, but the stigma qualitative. So you're looking at one research question, but different factors, and you use both method. That's the triangulation, okay? Because you triangulate the information from the different perspective and explore different factors. Some can be understood through qualitative, some could be quantitative. So that's the triangulation. So there you mix the result, you merge the data set when you explain that, because you want to explain or present that what factors influence, okay? So that, like, triangulation, wire interpretation, you have the both, and we say that these are the concurrent method. Because why the concurrent? Because you can collect the data at the same time. You are doing the survey, at the same time you are doing the maybe focus group discussion or in-depth interview at the same time, concurrent, okay? The second example I will give you, that, like, you want to see the, again, I'm going back to very recent, that COVID vaccine. So you want to look at identify the COVID vaccination rate in the rural urban area. And because you know that, and you also want to know that the low coverage area, where there is a low coverage, why there is a low coverage. Could you please, somebody, the microphone, turn it off? Louis, can you turn off your microphone, please? Because the sound is coming.
Our Connect colleagues, can you mute other people?
Can you mute Louis? Because I'm hearing a lot of sound. Okay, so so you are interested that, like, maybe you the Minister of Health said that. Could you please tell us that the different coverage of the COVID vaccination? And we want to know in the low coverage that why the coverage is low. So what you did, you thought that, okay, I'll do a survey with the coverage survey, and those who have not those who are not vaccinated, quantitatively you will ask what are the reasons. And then those who say different reasons, because in the quantitative, remember, it's a structured questionnaire. In the response rate, you can have very limited response. So you thought that I'll look at the response rate and I will do the in-depth interview to know why. So if somebody says that I don't believe in COVID, you want to know that why don't they believe? Or somebody says that, oh, I don't have access. What does it mean by access? Is it financial, or the vaccine was not available? So you did your survey, then you pick up the village or district, that why this low poor coverage, and then you analyze the data, and you found that those who are not vaccinated, they say different reason, and then you pick up them and then go and do the in-depth interview. So see what happening. You did the quantitative survey. From that result, you did the qualitative, and kind of an in-depth, you explored that what are the reasons that they have not vaccinated. So there are three things happened here. The number one, that, like, you have to do the quantitative one. because first you want to know that the low coverage area, and also you want to know that who are the participant or respondent did not vaccinate. Second is you quantitative, and then second is that you have to do the analysis first on the quantitative, because your second component, the qualitative, cannot be done if you don't do the analysis, because from the analysis you identify your respondent, and then in the third stage, you take that subset of population, you'll go and do the interview. So this design, can anybody tell me that, what do you think that which mixed method design it will be? There are 4 names here: triangulation, explanatory, exploratory, and embedded. The design I described to you, that the research, which type of design do you think that it fits? Just think about the name. Anybody? So what did I say? That they wanted to know the coverage, and the respondent or beneficiaries who have not kind of vaccinated themselves, they wanted to explain why they have not vaccinated. So which design? Okay, somebody put it in the chat.
Explanatory.
Excellent. Who said that? Absolutely, explanatory. See? So what is the explanatory design? Where the triangulation can be concurrent at the same time. You're looking at the different factors and you try to answer one big research question, holistic. In the explanatory design, it had to be sequential, because your qualitative will explain your findings from the quantitative. So you first, Venedine, can you mute your microphone, please? So first you do the quantitative, and then it's sequential, because sequential means one after another. And the second is that your qualitative, that the participant will be the subset of your quantitative survey, because you want to go in depth to understand, to explore. Those people who did not vaccinate, and on your survey said, I did not vaccinate, and even the quantitatively, they maybe respondent gave few reasons. So you see that the explanatory design, it explains. My method, I choose that method because I want to explain, number one. Second is it needs to be the sequential, because first you do the quantitative, you do the analysis, you identify the people, then you go and do the qualitative. And the third is your qualitative participant will be subset of your quantitative survey. So that's explanatory. So this data collection will be kind of an, the sequential, and you explain the result. And normally it has a big Q with a small qual, because you do a large survey and you do the qualitative to explain or understand the information that you want to dig and understand that. Clear? Is there anybody here did not understand the explanatory design? Oh, 2% responded. Okay, excellent, explanatory. So now, so you want to do a study, you're thinking about I want to do a survey, so that's the real story. So in Berlin, there's a pediatrician. So that pediatrician, he recognized, this is actually true, so he recognized that the children with the long-term condition that who admit in the hospital and stay for 4 weeks or 6 weeks, the mothers come to him and say that, doctor, my child is improving. But then he goes and then look at the all vital signs and the clinical, and they say, no, your child is not improving. But after 2 days, the child really improved. Or the mother comes and said that, I do think that my child is deteriorating and condition is not very good. And the doctor goes, no, the child vital signs are fine. Everything, the temperature is okay, the pulse, everything, all the vital signs. But after 2 to 3 days, it deteriorates. So then that pediatrician thought that, okay, I can develop a scale. If I can develop a scale, and with the item, and that it can be used by the health worker, because they will know even 2 days before, identifying those items in the scale, the child is improving or the child is deteriorating. So what do you think, that what type of study will be before the scale development? Anybody, what do you need to do? So what the mothers are saying, that what is that? What can we call it when the mothers say that? What would you call it? The mothers? Anybody? When the mother saying that, I think my child is getting better or my child is getting worse. Exploratory design, absolutely, because, because it's called mother's intuition. You cannot do a survey and identify that. You need to do either in-depth interview with the mothers or focus group discussion, or even you can have a narrative observation that you, because sometimes maybe mother couldn't say that what she feels, but maybe you will be in the ward, research assistant, whole day, and identify when the mother is going to the doctor, you can see that what the child is doing. So you need the qualitative exploration to understand and then develop a scale. So the exploratory design most often we use for 2 reasons. One is to, if we want to develop a scale, those items, or when you have a survey. Remember I gave the example of infertility, that my friend wanted to use the word, and then one of her anthropologist friend said, do you know that what the local people talk about? Do they say the same word? So sometimes in the survey, because that's your validity, because what you want to kind of measure in the survey, that if your weighing machine does not work, it will always give you the wrong weight, wrong result. So if you can't ask the right question in the survey and the mothers don't understand that information result you will receive and then analyze and present, it's not valid because they didn't understand. So most cases, sometimes we go and do the focus group discussion in the community or in-depth interview to understand the vocabulary, the local vocabulary, which we will use. Because remember, most of us as a researcher are stranger. We are stranger because all from the same country, same language, because we don't speak their own language. So this is the exploratory design. If you remember the name, triangulation, you triangulating. Explanatory, you did the quantitative and the explain. Exploratory, you explore. So your first design will be the qualitative, then the quantitative, and it's also a sequential because you need the qualitative. Now, think about somebody is a clinician, the randomized control trial. So I'll give an example. One of our colleagues from Heidelberg University, there are a lot of artemisinin resistance in sub-Saharan Africa, the malaria treatment. So that what he did, that before Second World War, the methylene blue was used to use to treat malaria. So what they did, they wanted to have a clinical trial that they mix artemisinin with the methylene blue together and have a medicine, and he was doing a randomized control trial under 5 children. Those who are with the malaria symptom, one group was giving this new drug, another group is the standard drug. But when he was designing the study, we asked one of my friends, she was a qualitative researcher working with him. She said, okay, I read the literature and I know that methylene blue can make the urine blue or the tongue blue color. So what about that if the mothers freak out and then the community don't come for the treatment, the participate in the study anymore? And he said, oh, wow, that's a very important thing. What can we do? So she said, let's do you start the trial and we'll go to the community, do the focus group discussion, do the in-depth interview to understand the mother's perception that what do they think? So they did the randomized control trial, looking at the efficacy of the drug. And the qualitative component was to understanding the perception of the mother. And most of the mothers said, oh, yes, after 3-4 days, it's gone. It becomes the blue color. So this is an embedded design, and embedded design is mostly used by those who do the clinical trial. So you can see that here, there's a two separate question. One question is kind of looking at the efficacy of the drug, randomized control trial. The second was the perception of the mother, but they are linked. Because if mother perception is that they don't accept the blue color, it doesn't matter that efficacy trial is successful, because when the pharmaceutical company will come, people will not take. But now they already know that maybe they will neutralize the color. So the embedded design, that where you have a big quantitative or qualitative, but the second component is very much supporting role. So like, we have done we are doing a study that one of my student in Afghanistan, she is looking at the non-communicable disease secondary data, the DHS data, that what is the prevalence of different non-communicable disease, huge secondary data. But then she is also interested to know what policymakers in the Afghanistan are thinking about NCD care. So NCD prevalence is nothing to do with the policymakers' perception. So she is doing the quantitative survey, but the second component, she'll go and do the key informant interview with the policymakers. But this is supportive role, because if NCD prevalence is high, it's important to know that what is the policymaker thinking, okay? Embedded design, you cannot publish as a single paper. In the embedded design, your efficacy trial or huge quantitative study will be one paper, your qualitative will be a second paper. So the triangulation, most often we publish as a single paper. Explanatory, most often we publish as a second paper, single paper. Exploratory, many times no, because you publish as a qualitative, as a, like the vocabulary, and then you published the quantitative, the survey tool, that's you develop the survey. So the survey tool you used, but that exploratory component, you used it in methodology, because that kind of validate your study, that you studied information. And in embedded, there will be two separate paper, okay? So these are there are 16 type of design, but like, okay, what should be the proportion of study design or Navid as quality, quantity, or mixed math in implementation research? No, it's not always 50-50. It's depending on the which component is very important. So whether big qual or big quant. So if you think about the explanatory design, most often is the big quant survey, small qual. In the exploratory, it's the big qual, because you do the exploration, but then you develop the survey, so that you survey, but you develop the scale, or you develop the tool, which is kind of small, but then that survey, you apply that in a big quantitative way, okay? So depending on, and the weight does not matter. Weight matters. As a researcher, you will make decision that what will be the weight, that which component you need more information. So there is no hard and fast rule. Sometimes it can be 50-50, sometimes it could be 75-25, but it's all depends on, as a researcher, which one is important for you, okay? Navid? So how do you choose research question, research question, research question, okay? And implementation research outcome of interest, not the health outcome. Remember, the health outcome, we implementation researcher don't care about health outcome. Our interest in the implementation research outcome, whether it's the fidelity, whether it's the feasibility, the acceptability, coverage, or like, the costing. The weighing equal or different emphasis, I already mentioned, it depends on you, that which component, and it's not like, set in stone. You have to make your own judgment that what your research question is requiring, which part. Type of analysis, mixed or phased, depending on the 4 design, that in the triangulation, you merge because you're looking at different factors. Explanatory, you have the quantitative, and then you explain it qualitatively, so that when in explanatory, you always have to analyze the quantitative first, then the qualitative. And then in exploratory, you do the qualitative first, because you want to pick up the vocabulary or some information which will help you to develop a tool or scale. In the embedded, it's completely different, because one is the randomized control trial or huge secondary data analysis, and the qualitative may be small or the key informant interview focus group. Resources availability. I always have resources available as a number one, because one of the major challenge of the mixed method is publication. Think about that. Most of the journal have word limitation. Now your methodology is double, your result is double size, your discussion is double size. So it's sometimes 6,000, 7,000 words. So sometimes it's very difficult to kind of publish mixed method. And also the expertise of the team. You don't have to do the mixed method. So think about the TBs. You think that I'm the quantitative, I'm not qualitative. I don't have any money to bring a qualitative researcher. I'll not use stigma. Or even if I do that, the quantitative researcher develop scale for everything, because they can measure love, hate, everything, but it doesn't make sense sometimes. So, but as a researcher, you said, I don't have the resource, I don't have the expertise. I will say that these are the 5 factors I'm focusing. I'm not focusing on the qualitative factors. So you can make the decision and you can publish, okay? When we publish a single publication, should we mention that we conduct embedded? Yes, you don't need to, because your clinical, those who are reviewer, look at your clinical trial paper, they don't care about the qualitative component, believe me. Or if you have the heavily quantitative, but in the discussion, you can bring it. That, like, we also look at that, because your discussion section always focus on 3 things. What is the research? What is the policy implication? What is the intervention implication? What is the research implication? So in the policy or the intervention, you can bring that. We also look at that, and the parents have, like, they don't have that, are not very concerned about the blue color of urine or blue color of tongue. Yes, that's a very good question. Okay. Okay. So the concurrent triangulation, that's the study we have done, me and Dr. Humaira, a concurrent triangulation. So kangaroo mother care has been kind of an routinely integrated in Bangladesh in the advanced primary health care and the secondary care, district hospital and sub-district hospital. And we wanted to look at the fidelity. So the research question was that what are the fidelity barriers and facilitator for implementing KMC in health facility according to national guideline. So we observed checklist. So there's a long checklist that looking at whether they are following the guideline. And then we did the key informant and in-depth interview at the same time. And that because we wanted to know that whether they're compliant with the fidelity of that kangaroo mother care. So that was like, concurrent the triangulation. But we can also design it as a 2-phase explanatory. Then our research question will be, the first phase will be, was the fidelity maintained in the process of KMC according to the national guideline? So we'll do the fidelity. And based on the fidelity, that if we see that in the fidelity that, they did not take the weight of the baby, or they did not, when you observe, did not instruct mothers how to hold the baby. Then second stage, we will look at qualitatively, depending on what we have observed. And based on that, we'll ask the question. What we did in triangulation, our qualitative was not dependent on the observation checklist. It was a general question. But if I want to do an explanatory, then I'll do the first phase and we'll identify what are the different bottlenecks in the fidelity, like in the kangaroo mother care process, because it starts from the baby admits in the hospital. We look at the weight, we look at the, baby's vital sign, and then we explain it to the mother. Then we observe the mother, whether they're holding the baby. Then we look at the improvement, and then we discharge. So in the first study, we looked at that parallelly. We tried to kind of did series of interview to kind of understand, explore different factors. In explanatory design, what we would have done, first we do the observation, have a different, the care, the continuity of the care pathway, that where the bottleneck, and look at the different bottlenecks and pick that up, and then go and interview where the healthcare care worker involved, interview the healthcare worker, where the mothers are engaged. We'll talk to the mothers when the attendance grandmother or anybody. So you see the difference. So the same study, not always, could be possible to use the defined method. One of the major, I would say that limitation of the explanatory design, you need time. So you need to collect the data, you need to analyze data, and then you go to the field and do the qualitative data. So it requires much longer time. You need to analyze fast. So that's one of the kind of I would say that challenge for explanatory design. So mixed method, again, what I say that it can be, it will be based on your research question. It improves the quality, the validity, and the applicability of the implementation research because you triangulate. So one thing I just want to mention about the triangulation can have different level. Sometimes we do the researcher triangulation. Like what? You did a qualitative study, you have a transcript. So that transcript, maybe I read the transcript. I also asked Dr. Manas to read, and I also asked Dr. Humayara, and then to have the more valid, because, you know, when you read the transcript, it's a little bit of subjective. So that's a triangulation at the research level. We triangulate the method level that we already described, the defined method we use, triangulation design, one of the design, triangulation of the method. We also triangulate the result, so that in the explanatory design, we triangulate the quantitative, you explain qualitatively, you triangulate that. Sometimes you also triangulate different approach. Same topic, you did the FGD, you did the key informant interview, you did the in-depth interview, same one approach, but from the different angle, okay? So remember always the triangulation word used, so don't get confused. We use it in different way. So what is the final take-home message? The mixed method definitely are useful. It uses both quantitative and qualitative. We talk about that. Quantitative is all about the breadth. Qualitative is all about the like a depth. The mixed method uses like a more comprehensive. So there are 16 types of mixed method, but the 4 methods are mostly used: triangulation, explanatory, exploratory, and embedded. If you know about these 4 words, immediately you can say that which method is that. Triangulation, define factors, triangulate. Explanatory, qualitative, explain quantitative. Exploratory, the qualitative helps us to develop the tool or like, you know, or the scale. Embedded, where the small qual or quan, that one component is embedded in the larger component, okay? And finally, I would say that anybody is already the PDF available. My kind of, and really the Bible, Gita or Quran, whatever you say that as a book is Creswell, John Creswell, and it's available as a PDF, even that in recent 2018 version. So please download that. Is the one of the excellent book for the mixed method. Okay. So I have, I think, 5 more minutes. If Dr. Mahanas allows me, if there is any final question that you want to ask me. And I hope I was not too fast, because I teach mixed method in Heidelberg in 2 weeks. So I just wanted to capture, you have a basic understanding, but is there any question, comments? Okay, thank you so much, Elena. Yes, please, Edwin. Good to see you, Edwin.
Yes, thank you,
Yes.
Didi. So nice to meet you. And
yes,
I love your spirit in research. Yeah.
So what's your question, Edwin?
So I have a question like regarding this qualitative, because nowadays like most people using like a phone. Like we conduct the FGD using like WhatsApp group. Is it possible that we can validate that WhatsApp group also we can use as one of the method for qualitative research? Maybe, yeah.
Like, you know, there are a lot of kind of, you know, that the methodology is not stagnant. It changes with time. So now the WhatsApp group, but even now they do that, like, you know, net analysis, that you look at the Facebook comment and then you analyze it. That's the people are doing. They do the phone survey. So because of the COVID, there's an opportunity. And also because of this technology, different technology, these are acceptable, because in many cases it's very cost effective. But you also have to remember that if you do a WhatsApp group, that there are certain limitations, that whether your participants maybe they don't have the access to the technology. Maybe they are not technological literate. But if you're doing the study of the medical student and you want to explore a topic, of course, but depending on whether it makes sure that your target group has the access, they have the competency or skill to use that, they understand that, and you can communicate better. It's a different skill than in person. So if you consider all of these, it's fine.
Great.
Okay.
Thank you so much.
Atif, Atif is here too. Oh my goodness. Lovely. Okay, what is the question? Quantitative part from a different timeline of different project and then follow up with a qual part with different project in a different, absolutely. But it depends on the topic, same topic, but the timeline, or you have to be careful. The timeline is important. It's related to the topic. Think about that. After COVID or HIV, everything happening very quickly. So there are some topics, that within 3-4 times, there's not major policy change. There is not major intervention in that area. And you can have the quantitative or the one timeline and then go and do the qualitative. But you have to be mindful and careful whether the timeline influence your result or not. And what is the topic, whether it's the timeline sensitive or not. Okay? Okay, Atid. Okay. Okay. I wish I will teach you in person. It would have been more fun. But
Exactly.
it's lovely to see Atib, Edwin, Oni, Naved. These are like, the students you'd see. I remembered all of you. So it's lovely to meet you again. And thank you,
so
Dr.
much.
Anna and Dr. Mahanaz. Thank you so much
You're
for giving me
welcome. Thank you so much for your time. I know that you just arrived in Bangladesh last night, and you've been extremely tired and jet lagged. Despite that, you accepted to give this lecture. Really
my
appreciate
classroom is always my antidepressive or my happy place.
Thank you.
So,
Yes.
but thank you, Dr. Manas. Thank you, everybody. And please, you can always find me on the internet. Anything on the mixed method, you want to send me an email for clarification, or you are doing any study, we can set up a Zoom call or WhatsApp. Edwin said WhatsApp, we can have a group discussion. Welcome. I always respond to students, and those who are my students, they know it very well. So I'll always respond to you.
Thank you so much.
Thank you so much. Thank you, Manas.
Everybody, thank you so much for staying back until the end. That means a lot. So thank you so much, Dr. Malavika. And then we have the recorded session and we distribute it amongst colleagues. I think there's going to be a survey at the end, colleagues. Please do complete the survey of this lecture, as you're actually checking the quality of the lectures and any comments coming from you. Once again, have a lovely day. Thank you, Malavika.
Thank you, Dr. Manas.
Bye.